An angioplasty is a procedure that opens up blocked blood vessels without surgery. During the procedure, the cardiologist places a sheath into artery in your groin or wrist. The cardiologist will guide a small catheters into the coronary arteries through this sheath. Then your doctor will inject a small amount of X-ray guide through the catheter. Patient may feel warm flushing at this time. The dye will enter the coronary arteries. The blockage will find through X-ray. When the blockage is found, a small balloon with a stent will be inflated at the site of the blockage, widening the blocked artery. It may be inflated several times to push the plaque against the artery walls and open the artery enough. When the balloon is inflated, the blood flowing through artery is stopped for short time. Patient feels chest pain. The stent keeps the artery open. This procedure takes 30 minutes to 2 hours, and patient discharge usually 12 to 24 hours. Although angioplasty is an invasive procedure than bypass surgery. Risks of angioplasty are bleeding at the point of injection, blood clots,